We will.
And you publish it? And will you publish at YouTube?
Yeah, it will be available on YouTube, Doc.
Okay, thank you. So I will, I can share to other people because this issue we have to encourage this issue to others.
Sure.
Because
Yes, thank you, please.
yeah,
It's going
I
to
will
be
upload my
live.
Instagram into my yeah.
Thank you.
Yeah.
It will be live on LBH Jakarta's YouTube channel.
Ah, that's a good thing.
Okay. We already live, guys.
Okay, I'm going to
Okay.
close off my screen then. Okay, everyone, good luck with the event.
Good evening, everyone. Thank you for joining the Refugee Legal webinar series in this evening. So we will start in short. Thank you for your patience.
Is my voice clear? Good evening. Sorry, it's evening now.
It is clear, Aden. Thank you.
Yeah, okay. Thank you so much for joining the event. My name is Aden. I'm the facilitator of this event this evening. And thank you for allowing me to be the facilitator of this event. I really appreciate for this opportunity. And thank you for joining all participants and the speakers and the technical assistants. Thank you so much. My name is Adam. I'm one of the refugees living in Indonesia for 7 years, and I'm living in central Jakarta. And as I have said, I'm going to be the facilitator of today, and I want to make a quick um, um, reading here that what is our event all about. We are going to discuss about COVID-19 impact. Despite its global pandemic, that we as a refugee living in Indonesia, we have got, we have actually affected the COVID-19, and our topic is related to COVID-19. Tonight, we are going to discuss the general, basically general information and regulation of COVID-19, like wearing mask and the role of refugee and the COVID-19 related the refugee living in Indonesia. So we have our speakers here, two speakers, Dr. Mohammed Fajir, a medical doctor and COVID-19 volunteer. We also have Rizka Arjandianti, Swaka chairperson. So this is our speakers, and our topic is related to COVID-19 and wearing mask and etc. And one more thing I would like to make very clear is that the event will be live and it will be recorded. There will be a Q&A questions, and your question will be, please put your question in the chat box. And also, yeah, I think that is a quick introduction that I made. So, yes, Mr. Julio.
Yes, Aden, thank you. Please continue with the speaker's presentation.
Yeah, so
Halo, Aden.
Yeah.
Aden.
Yes. Yeah, I'm going to invite
Roger, what?
yeah, I'm going to invite Dr. Mohammed Fajri to give us this presentation.
Hello. Good evening. Sorry. Good evening. Do you hear me?
Yes, we can hear you.
Yeah.
Yeah, we can hear you.
I'm sorry. I just need to put. Okay. Good evening, ladies and gentlemen. It is an honor for me. I am Muhammad Fajri Adai. I am medical doctor in Jakarta. I also the the public service doctor who serve COVID-19 cases, and then I also serve a refugee in my daily basis. So I have served maybe I don't know. I cannot count it, but I serve and helped a lot of refugee in my workplace area. So it is very delightful for me to give presentation and education regarding COVID-19, which has very big impact in our life right now. Okay. Okay. Do you see my screen?
Yes, we can see your screen.
Thank you very much. Okay, this is how many people join this presentation? How many people join this presentation? 20? 25?
So far, we are 21 individuals participants in that.
Okay. So I just want to say that this pandemic is very very hard, because a lot of people right now feel very fatigued. Then we just need to stay. We just need to resist it. We just need to do anything that we cannot do, because this is like Russian roulette, The infection is the spread of infection is very fast, so they can choose anyone. They can choose whoever they want to infect. No, everybody, as long as live, as long as breathe, they can be infected and they can be infectious. That's why this is very important meeting. I mean, okay. The impact of the COVID-19 in Indonesia is very big, and the number of the COVID-19 is uprising. There is no declining. Yeah, you can see for today there will be there was 6,000 and almost 6,000. Sorry, almost 150 death, more than. So this is very big. Do you from this slide I want to know that the refugee who live in Jakarta and Jakarta suburb, you're very lucky because the capacity testing in Jakarta is very high. As you can see, in total there is 60,000 specimens every day, or this day they were examined. But Jakarta, you know, it's almost the fifth or 20% of the specimen were come from Jakarta. So Jakarta is very big capacity in order to test and treat and tracing patient of COVID-19 in compared to other provinces. And you have to know that active cases in Jakarta is also very high because you see that half, as a third, it's almost third of the PCR tests is from Jakarta, and you know, the positivity is both WHO standard. The standard of WHO is around 5%. And the positivity rate of Indonesia is about 15%, and it is very problem. It's a big problem. And nationally, Indonesia only 15th province in Indonesia that have minimum capacity tests regarding WHO suggestions. The WHO suggests that 1,000 tests per 1 million population per week. And Jakarta 90 or 80 compared to standard. And also another province, it is only several provinces that can join Jakarta to reach this minimum standard. What I want to say is, if you are in Indonesia, you have a big, threat because the COVID-19 in Indonesia is not going down, and it is still uprising. So beware. It is what I want to say. And the capacity testing is not that good and spread well according to nation. And do you know, this is important because Indonesia, the 75% of Indonesians are planning to travel during year-end holiday. So it will, I'm just speechless to read this report. This is from WHO situation report. So because the condition is not good, but the situations, the society, they just don't get awareness well. So as we can see, I don't have any news in English because this report is published in bahasa Indonesia. So the third of the population, only 30% of the populations following the guidelines, but it seems it will be long, and the awareness is going low. So it is very pathetic because the COVID-19 prevalence or the COVID-19 number is going up, but the awareness is going down. We can see this is from yes, government. Yes, this is the President Secretary YouTube channel. This is data is from that channel. So yeah, and I want to say that I'm very, sad because this is the conditions of the shelter before the pandemic. It's the last year. It's around last year, but I don't know. I don't have any picture, but I think it's rather similar because the people of the total number of the refugee is not going down. So I think the condition and the reality of the asylum seeker or the refugee is very hard because the density and facility is very challenging right now. I mean, for other citizens beside refugee, the condition is very hard. Moreover, to the refugee, I think the condition is more harder. That's why I think how can we adapt and how can we adjust our life is very important in this during this pandemic, because the problems from the problem that the refugee face is very hard. This is this is a publication from the Lancet. What I want to say is the condition we need to do the social distancing to reduce the burden of this problem, the burden of this pandemic. If we are not doing the social distancing, the COVID-19 number will be so high. So the impact is the hospital will be full, and then the death number will be the death toll number will be very high. So I think this is important to spread to the other refugee or other people who ever care with refugee. The participant of this meeting is only 24 persons, but I hope this information should be spread and should be heard by other people because it is important. If we do the good thing, Kathy Armstrong from Imperial College London, they say that we have to do something. If we do nothing, the uprising of the number of the COVID-19 will be very high. And if we only close the school and university, there will be decrease, and also decrease if only the case isolation alone. And this is a big problem. It's not only in Jakarta or in Indonesia, it's a big problem to the other country around the world. So this is the another story that very broke my heart, because you know what, this is when people going to Jakarta, you have to know that you don't have to pay as long as I know you can do the testing or swab PCR by coming to the primary healthcare. I was asked my colleague that you can do the swab PCR test because the two asylum seeker from Afghanistan do this test by themselves. They have to pay, and I mean the payment of this test for me is relatively expensive. It's around 900,000 rupiah. It's around $1,000, right? $100 is around that. So I think it's hard because you have a free facility in Jakarta. Gitu. You have to come to puskesmas or primary health care that you're located, but it's only free in Jakarta, where you domicile, where you live. If you live in Johor, you come to my place. If you live in Cawang or another place like Kalideres, you can come to the primary health care in Kalideres. This is what we are facing, the overcrowded shelter. What I want to say is the risk of the refugee to get the COVID-19 is very high because the overcrowded shelter and the number of the refugee that live like this is around 8,200 refugees, including families, small children. They are living in overcrowded and unsanitary conditions. So this will be a big problem, or maybe this was a latent problem. We just don't check it, so we don't know it. Maybe a lot of people among this refugee was infected COVID-19, but they don't know, and they spread to the other family or others refugee in that shelter. And the condition is different between one region and another regions. Maybe in Aceh, they cannot be tested freely in the primary healthcare, but in Jakarta you can test it. I mean, I don't know, whoever who care for the refugee whoever who care the refugee should focusing and should should upgrade the issue because and should speak because I'm a doctor. I'm very sad if people get sick, and I'm a doctor. I was teach to help other. So refugee is a human. Refugee should be helped, and the refugee because refugee is a human. Refugee is also can transmit the COVID-19. They can infect it and they can infectious to other people. So we have to solve this problem. And Prof. Nuka from LIPI, they said that,
Yeah, Dr. Mohammed, your time is up, but you have 10 minutes additional.
Okay.
The additional 10 minutes, so please go ahead.
Okay, so this is a big problem because 5,000 of the refugee, they don't have any shelter. Okay, and the condition in Jakarta is very bad because the 80% of the isolation room in the hospital were occupied. Okay, what I want to say is you don't have to be worried because it's around 80% of the people who infect COVID-19 will be asymptomatic or mild diseases. And only 2% or until 5% will be dead or suffer severe conditions. But you have to be aware, stay aware, always aware, because there's only people, yeah, who get lung transplantations instead of he was she was 20s and she was been very healthy. It means you have to be aware, but you don't have to be too worried. So I mean, you have to take your position in the middle. And COVID-19 can infect a lot of organs. They can infect heart, heart, lungs, brain, eyes, nose, liver, kidney, and intestine. It means the manifestation of the disease, the clinical manifestation of the disease is very broad. It's like red eye, and then you can anosmia, or you cannot feel the smell. You cannot smell. You cannot smell. You cannot smell, and then you cannot taste something. Or your diarrhea, because the virus can infect the intestine. So the manifestation clinics is diarrhea. You know diarrhea? I think you know diarrhea. And then you can feel like dizziness or fatigue, or you hard to concentrate, because the virus also infect brain. Yeah, this is the, sorry, I don't have any English versions of this slide. Yeah. And if you're young, you should be always aware, because you can see this is death, and young people under 30, they also die because this diseases. So you have to be aware. I want to say. And if you have no underlying condition, you should be aware, because there is more than 88,000 people who don't have any underlying conditions. They also get hospitalized or ICU admission or death. That's from CDC, America. And what I want to say is, if you are sorry, I mistyped this. If you are not from this case, sorry, committee, can I add maybe 10 minutes or 20 minutes?
Yeah, you still have
6 minutes.
8 minutes. Yeah.
What I want to say is, this is a case report from China. What I want to say is, there is somebody come from Wuhan. He has COVID-19 in his body, and he met his teachers A and D. Okay, before he showed the symptom, he met the teacher, and then the teacher get the diseases. After that, the teacher spread the virus to the other people, such as wife and sister. It means COVID-19 can be spread, or can be infected by people, can be spread by people who doesn't have any symptoms or presymptomatic. It means before you show the symptom, you also can spread the virus. That's why the potential methods of the infections is super spreader. I want to show you the good literature. I'm sorry. I'm sorry. Yeah, this is the science of super spreading. I want to tell you that how can the COVID-19 spread. So what is the meaning of super spreading? When people can infect a lot of people. You can see this is one people attend a big meeting. At least 97 people who attend this conference has infected. You can see this. You see the graphic. This is a super spreading event. That's why you should avoid the crowded place, such as a lot of place that crowded, such as gym or restaurant or other places. And one people. This is have you ever heard the R number? R number is one person can infect two people, but is in the reality it's not just that number, because one people can infect 4 people and one people can infect 20 people. So this is very big. So what is the relevance to the asylum, to the refugee? Can you imagine if somebody get infected in shelter, so the whole shelter can be infected, all people in that shelter and or all people in that camp can be infected. This is very, very big problem. Sorry. Because CDC said that half of 1 in 2 patient COVID-19 could not identify a person with COVID-19 who they have close contact. So they don't know where they got the virus. So how can we stop the infection? So you have to know there are 3 elements that interact to be a transmissions of the infectious disease: host, pathogen, and environment. You have to cut this or this. So this is I cannot play. This is how the pathogen spread. When you say something, the pathogen or the droplet can spread up to 8 meters in front of you. Can you imagine if you're standing or sitting in the closed room without good ventilation? This droplet contains a virus, and this droplet can infect you. That's why COVID-19 can easily spread to other people, because they can spread by the air at the closed room without good ventilation. Can you imagine if people live very closely and they talking, they are speaking, laughing, or coughing, they can got this droplet.
Dr. Mohammed, sorry for the interruption. Your time is up, but you have 5 minutes.
Okay.
So please.
Yeah, that's why CDC or WHO say you have to stay away from other people, especially in classroom and closed spaces. you have to improve your ventilation level, because the COVID-19 can be transmitted through airborne diseases. This is what I want to know. I want to say. This is why you have to always wear mask. This is, you can see, this is air. If you use your mask properly, you can block the air. And you can reduce the risk of the infection by 80% if you use mask. You can, yeah, this is the, how, yeah, this is study case. Sorry. And when you're coughing, you have to, you have to close your mouth by anything in front of you, because people in front of you can get droplet or virus if you don't, if you not cover it. And you have to improve your ventilations. Yeah, when you're going to the market, you have to, stay away from other people, and this is the example of the good market. Yes. When you're going to the mosque to do the religious thing, you have to stay away. But in my suggestion, you don't have to go to the mosque during this pandemic, because because there's a lot of potentials, a lot of potential research of infections. It's also church, because there's a lot of cases happens in church. A lot of COVID-19, a lot of people can get COVID-19 from the church, and it's not theory, it's a fact. So when you're thinking that you have COVID-19, you have to, you have fever, you have cough, you have breathing problem, you have runny nose, or you know that your colleague or your friend get COVID-19, you have to the nearest hospital or call 911, or you can go to the nearest primary health care at your region. It's important, because in Jakarta you can get free swab. And the other symptoms is diarrhea, or you cannot smell, or you cannot taste. When you eat something, you cannot taste it. It means this is, you have to be you have to be aware that you may be got COVID-19 in your body. And if you are suspected, or if you are got the symptom, you have to be quarantined for minimum 2 weeks. You don't have to if you don't have any opportunity. If you don't have any opportunity to get the test, you can do self-quarantine. But it is better to to test. And there is 54 lab around Jakarta that can provide the COVID-19 test. And the 50% of this number is free. The capacity in Jakarta is in August, we have 11,000 sample, and 50% of this is free. So you can go to the primary healthcare in Jakarta. So I think my presentation is enough because the time is up. Thank you. I'm sorry for my English. because I'm still learning to be fluently English presenter. Thank you very much.
Thank you so much, Dr. Mohammed Fajri, for the wonderful presentation. This is really helpful for our refugee and asylum seekers colleagues. And thank you so much for the wonderful presentation once again. And we are going to invite Sister Riska. She will be sharing about information related refugee legal subjects before Indonesian law. So she will be giving us her presentation will be related the legal matters related to COVID-19 and refugees living in Indonesia. That whether as a refugee we are abide the law in Indonesia, whatever regulation that the government in place to the locals. So, Priska, please welcome, and the floor is yours.
Okay, thank you, Brother Aden. So my presentation, it's about because we all have COVID in this world. It's not only Indonesia, it's not only in Jakarta, it's in global. So we have to be aware that this pandemic means it's already global. We have to do something about it. And not only the people, but the government also have to do something about it to regulate the condition and also to make the condition becomes better. So we are all already learn about what is COVID-19 from Dr. Fajri, and he already explained to us why we have to be aware of this virus, the COVID-19. What I can say again, what I can reiterate is the COVID-19 could affect everyone, could affect anyone, even if you are feeling healthy. It doesn't mean that you are immune to this COVID-19. And also Dr. Fajri already explained that the curve of those who are tested positive is rising, yet the awareness is getting lower. So by this discussion, I also wanted to, Swaka also wanted to raise that awareness again that this COVID-19 is still there and we have to be aware of the situation and we have to prepare ourselves for a longer, maybe longer period of time of living with COVID-19. And surely do the health protocol strictly. That's the least thing that we can do to protect ourselves. So what are the regulations related to COVID-19? Indonesia government already enacted several tons of regulations about how to deal with COVID-19. From the budgeting, procurement, as you can see in my presentation, public servant, immigration, finance services, health, manpower, capital market, education, trial, trade, tax, customs, good governance, and transportation. But this all is applied to those who are live in Indonesia. So not only Indonesian, but refugee also, foreigner also, who are forced to stay longer in Indonesia, maybe because of the pandemic, they cannot fly in or fly out from Indonesia. And because of the Indonesia is so big, we are speaking about the 2,000 kilometers square something. I don't know how big Indonesia is. So the local government should regulate themselves, their territory. So there are Bali, Banten, Jakarta, West Java, South Sulawesi, and North Sumatra. The local government there already enacted several policies as well. I'm going to highlight actually some of the regulation enacted by the central government, which could affecting the refugee community. Surely immigration, it's the part that you always hear almost every day. You may hear someone getting raided or even someone getting arrested from the immigration, or you have to deal with immigration stuffs. And after immigration, I wanted to go to education because some of the refugee community have their own learning centers, and this is also affecting to the daily activities, right? So there is no learning, studying activity in the school, perhaps, or there is other activities for the education terms, and for the transportation as well. So there is a need to move from one place to another place, and how is it going with this pandemic? And trial, for those who are dealing with the legal issue and should go to the trial, should you go to the trial physically? Is there any other things that we can do to prevent ourselves to be contracting the COVID-19 but still dealing with the process in a trial? And also, I want to highlight several policies issued by Jakarta governor and also West Java governor. So let's start with the immigration. The immigration policies. The health protocol for Indonesian coming home from abroad means migrant workers, students, boat or ship crew, etc., or foreigner entering Indonesia should follow the health quarantine procedure and also additional health testing. This is coming from the circular letter or their own regulation on how to deal with the pandemic, but still needs to processing several incoming person. So the first thing is when you coming to Indonesian territory during this pandemic, you have to validate health certificate maximum 7 days. If you are coming, if your family coming from outside to Indonesia, so they should be tested first before they go abroad, before they take the flight to Indonesia. And the health certificate should at least 7 days maximum when they are arrived in Indonesia. And after that, they have to be interviewed, checking the temperature, sign, and symptom of COVID-19. They have to be checked and have to pass this checking and checking the oxygen saturation and also rapid test, reactive or non-reactive. If reactive, they should follow the several procedure, means like Dr. Farji already stated the quarantine. If it's unable to have self-quarantine in your home, it's because it's too crowded in your home, you can use the government facilitation, government accommodation to quarantine. And make medical evacuation if there is a case of foreigner who are sick or dead. In this case, the costs are fully borne by the respected country. So if you are wanted to send a body from Indonesia to outside, let's say Suriname, so you have to be in contact with the embassy of Suriname in here, getting the clearance from the immigration and also the doctor. And after all the clearance and you know who's gonna pay for that, even though it's stated the respective country should pay for it, but it could be paid from the other side if you have the guarantee to pay for it. So yes, it is still possible to do evacuation, medical evacuation. And the third one that I can highlight from the policy is the new normal protocol providing service during pandemic. So you may heard that some of refugees being detained in the international zone, and the staff it's not really there because of some of them are working from office, some of them are working from home, so the staff is not fully 100% attending the office. So there is a limitation to the providing service from the immigration. And next, education. As you're also aware that the Indonesian student is not attending any school. They are attending school through online education, and the policy is quite clear for this year, actually, that the learning activity should be done by online only. But currently, the Ministry of Education enacted the new policy that certain areas with a green status, like Jakarta is a red status actually, but in some area in Indonesia has a green status, could open the school only if it could and agreed by all school member. So this is the component that should be fulfilled when you want to open a school. And this is not only applied to public school, this is also applied to private school and also the vocational school, all of it in Indonesia. Even if you saw courses in certain places, they are closed also. This is because of this policy. So I assume this policy is also affecting the learning centers run by refugee community. And actually, this policy should be also done by the refugee community as well. If they are running the learning center, so that means the activity should be shifted from offline to online learning activity. And the second one is internet incentives. Though some of the people say that the incentive which issued by end of last month, I guess, not that early as possible, but at the end of the semester, it's kind of a bit late actually. But some of the pupils, some of the students say that it's quite helpful for them to buy the internet quota and also following the learning education. But this is actually, unfortunately, cannot be received by the refugee community, the internet incentives. This is actually for the public schools only. Next, transportation. Transportation is, you may already know that we have a several procedure. We have to follow several guidelines. If you want to take the train, let's say to commute from Bogor to Jakarta, you have to wear a long sleeves, wearing mask, not scuba mask, and wearing washing hands and other things. There is a certain regulation that we need to follow. But doing transportation is not only commuting, but also going outside of your area to another city or maybe another country. So based on the policy, the guideline on how to travel is that you have to follow health protocol. This is the must. And the COVID-19 testing or no symptoms of influenza-like illness notification letter from the primary healthcare facilities like Puskesmas. Downloading and activating Peduli Lindungi application. You may want to download it. I already downloaded, but since I live in the red zone, it's always alerting me that I am in the red zone. Yes, because Depok is a red zone already. But if you are only commuting, not taking any flight or any ship to go somewhere or a long train trip, you don't have to follow that COVID-19 testing, the number 2. Actually, if you only commuting from Bogor to Jakarta to Tangerang, etc. And if you are coming from abroad, like I already explained also in the immigration, but this is related. PCR testing when arrive, if no test being done prior to departure, is you have to do that. And quarantine and special quarantine accommodation provided by government or hotel, which has Ministry of Health certificate on arranging quarantine accommodation. If you have family or relatives coming from abroad, they have to follow this procedure. And from the trial, Swaka actually assisting several cases that we need to be in contact or communicate with the trial staffs, with the court. And in this next Pak Jiko, in the trial, in this pandemic situation, the trial proceeding will be done through teleconference. So some of the person, experts, witness can be summoned to the trial through the teleconference. And case handling through the electronic approach by email or WhatsApping or anything that can be used, electronic application can be used to sending or receiving documents. And the last one is releasing convicted through assimilation and interrogation and integration with the local Indonesian. So yes, this is the threat is still ongoing until now. At least yesterday, in Kalimantan, several convicted released through this assimilation and integration because of the detention. The jail is already crowded, and they need to be released. Otherwise, to decrease the possibility of spreading COVID-19. And next, I want to go to what Jakarta governor regulate about COVID-19 in Jakarta. As you may heard, actually, large-scale social restriction until 20th December 2020. And what it is in large-scale social restriction, that you have to wear a mask in public space, if not 250 Indonesian rupiah fine will await you. Or sometimes Satpol PP, the one who rate the health protocol violation, they will give you a fine, a social fine. They said you can do sweeping the street, the road, or you can do push up even, or sit up or something else like that to replacing this 250,000 rupiah. And the third one, if you are unable to do self-isolation, you can use government-provided accommodation. This is what the government of Jakarta said. And the last one is capacity limitation and physical distancing in shop or store. Dr. Fajri also already mentioned that you have, if you go to the market or if you go to the gym, let's say so, if you go to the gym or if you go to the mall, just be aware that you are still in the quota of the capacity in that store. Otherwise, you can't do any physical distancing. That is in Jakarta. And in West Java, next, still the large-scale social restriction is until 23rd December 2020. Next. And in West Java, there are micro-scale social restriction proportionally. So you may heard that in one village, in one RT or one RW, that they will have their area locked down, only one gate in, one gate out in the same gate. It's called micro-scale social restriction. And it is allowed by the government to do so, but you might not found it also in another RT RW. So that's why it's called proportionally. It depends on the need of the community in that area. And the fine is around 100 to 500,000 Indonesian rupiah for violating health protocol. You already heard about the fine. You already heard about if you are contracting COVID-19, I should get tested. To where I should get tested? Who already have the authority to take me to the health facility? and who have the authority to fine me with this 500,000 Indonesia rupiah for violating health protocol. So who are they? Next. If you're about to be tested of COVID-19, health workers like Dr. Fajri, including those from Public Health Officer atau Dinas Kesehatan, you may see these three logo on their upper arms of their uniform. I forget it is right or left, but you may see one of these three logos from their uniform. And those who has authority to fine you because you are violating health protocol, let's say you are going away to the market without any mask, and then Satpol PP coming and then find you, who are they? So next, Satpol PP is the one who are wearing a uniform like this, and that's the logo. The blue one is their logo, and they have a beret and also their uniform. So you have to aware actually when you are getting taken for having a test, the COVID-19 test, you have to make sure that they are coming from the health workers or the Dinas Kesehatan, public health officer, or even if you said that you are under UNHCR or you are under the IOM or CWS or any other organization, you have to be aware that the authority is not coming from them. If you have any symptom, this is from the practice. If you have any symptoms and you going to the primary healthcare facilities, puskesmas, let's say, I have a symptom, I cannot smell the symptoms like Dr. Fajr already explained. And you can come to puskesmas and get the test. The prior practice, the test was free. We never knew the policy will be changed or not, but there is a quota for a free test if you are coming with the symptom. We never hope that we are coming to puskesmas or any healthcare facility with a sickness. But you have to know that the procedure, the government procedure on mitigating COVID-19 is affecting to everyone who live in Indonesia, including refugee community. So that is from my presentation. Thank you very much. Back to you, Aden.
Thank you so much, Rizka, for the presentation. Thank you so much once more. We are going to have the Q&A questions. So there are questions that related the respective presentations. So Shogi Ramalan and Ibrahim Wadi asked to Dr. Fajri, is there any locally manufactured COVID-19 vaccine? So if the vaccine is arrived in Indonesia, will it be available for everyone, including refugees, for free? Do you expect the pandemic to end soon? And
Yeah. Okay. Is it enough, or you want to?
yeah, there are others, but should I continue reading the?
No, one by one, I can remember.
Go ahead, those ones.
Okay, if you ask me, how can the pandemic end? It depends on several factors. I have the information slide, so sorry. Share screen. This is how the pandemic will be ends, or the pandemic will not be end, and the COVID-19 has changed to be endemic thing. Endemic, it means it's like malaria, you know. It's like malaria. It's endemic. In 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 beach area or pantai, pesisir pantai ya, in beach area, the malaria or atau di rawa-rawa gitu. It's common. It's SARS-CoV-2 or COVID-19 will be like that. Will be. It's publication from Science. They say that yeah, it may be it's very long. It depends on several factors such as immunity. For this up to now, there will be there was a fact that our immunity against COVID-19 can be less can be it can be there up to 8 months in several populations, but a lot of people that survive from COVID-19 after they got infected, the immunity is only short. It's maybe 2 or 3 months, and it also depends of our intervention, vaccine, or another thing. Vaccine. Uh, Indonesia is doing the vaccine research in joining with Sinovac from China, but the result is maybe in March or April, and the productions of the vaccine will be start maybe in after that, and so it means it's very it's long. It's a long time. We hope it's not that so long because UK or another country start vaccinated the people or the citizens. But Indonesia, I think, in the government of Indonesia has not ordered or not win to order the Pfizer vaccine or Moderna vaccine, which be known, which has been known that the efficacy of the vaccine is more than 90% of protective. So I don't know. Maybe we just need half of a year or maybe 1 year anymore to resist this pandemic. And then are the refugees free? Are the refugees free to get the vaccine? Today I post in my Instagram. You can follow my Instagram. There's only 70 million. It's around 70 million people who can get the free vaccine from the government. So the government has been set the budget is for about 65 trillion rupiah for vaccine next year. It means, I don't know, the refugee or the asylum seeker can obtain or not the vaccine. I don't know, but it seems uncertain. It's very uncertain because the citizen of Indonesia, not all of the citizens in Indonesia can get the same opportunity. The priority of the vaccine is for healthcare and other people's, not all of people. Yeah. Next question is.
The next question is from Bartel to Dr. Fajri. If the pandemic lasts for a long time, for example, 10 years, what will happen? What are the impacts for refugee communities?
Wow, it's it's a good question, but it's hard to imagine. I can imagine how can this, this very debilitating virus, debilitating debilitating diseases is very bad. This disease is very bad. I can imagine how can refugee can resist this, because without this pandemic, the refugee needs a lot of things to stay healthy. How can they will face this pandemic so long? I can imagine that. So if you ask me what will happen, well, there should be there should be an international collaboration. There should be a specific specific harus ada gitu yang specific treatment. There should be specific treatment from country around the globe. They should think refugee better than now, because the refugee life it will be harder than before. You should very aware about your healthy, such as you cannot sleep in the street, you cannot sleep in the large area together. No, you can, yeah, and the shelter, the level of the shelter, the facility of the shelter should be improved, because I can imagine if one people in one shelter got COVID-19, this one people can spread to all community at that shelter, and it will be very bad news. I can imagine how can it happen to us. Yeah. What is? Yeah. Next question.
Oh, okay. Rizka, can you elaborate more about this question?
The impact, yeah.
Yeah.
Yeah. If this pandemic goes so long, we will face. I heard uncomfortable sound. If the pandemic goes so long, and what will happen with the refugee community? That what I have in mind is the process of the refugee who wants to move to another place in the world. So before, if you want to flee from another country, you can just take a ticket, getting the airplane and entering the country of your destination. But with this pandemic, you have to follow certain checkpoints before you have a flight or before you depart with every mode of transportation. And then when you arrive, you have to also you are required to follow certain procedures. And if you are already, this is also affecting to the resettlement, because the resettlement process is already takes a long time, and this pandemic will cause it more longer, because you have to take also certain procedures, such as you have to take the COVID test, you have to pass the test, and you have to take the isolasi mandiri, self-isolation, self-quarantine in Indonesia before departure. And when you arrive in the third country, you have to also take this process. So yes, it will be longer, it will be harder, I may say, for the refugee community if this pandemic goes so long. So that's why we need us together to end this pandemic together. Thank you.
The next question is Bashoki for Dr. Fadri. Refugees are often found living in difficult conditions. For example, being confined inside their home. What are the tips you can give to avoid the virus?
I don't understand the question, but Yeah, I understand.
Then,
I understand. I understand.
okay.
Mm, because this is a very big problem because uh, the refugee live in very limited yeah. Hello, can you hear me? Hello.
Yes,
Yes,
yes.
yes, Dr.
Okay, okay,
Fajri.
okay. Yeah, the refugee live in very limited place. So if you ask me, how can the first thing you have to find the place, the spacious space, the spacious place. Sorry, the spacious place. First. The second is you have to, because it's not only spacious, but they must have a good ventilation. And then you when you meet somebody, you have always to use the mask, and you have to maintain your distance. uh, i am I am serving the COVID-19 patients for almost maybe for almost for all period during pandemic. And bless of God, I don't have any virus in my body, because I am doing the health protocol very strictly in my daily life, in my daily basis, such as if somebody talk to me, if somebody you know uh, going going to me, I will make myself uh, I will beg, or I will make my distance to that persons 2 meter or more, and I will ask him or her to put on mask. The first thing. The second thing, if you see anybody, including your friend, your family, your relative, whoever can bring the virus, and you don't know his daily life or her daily life, you should avoid directly contact, such as sitting in the restaurant, sitting in the uh, cafe or a park, or or any places directly. It is the main route. It is the main route of COVID-19 spreading, because you are feeling safe. You are feeling safe, um, sitting around your family, around your maybe your partner, anyone, but they can infect you. This is very important. So you have you have you have to be aware to everybody in front of you. And the third thing is, uh, you have to avoid the crowded place. Everywhere, mosque, market, or hospital, you have to avoid the crowded hospital, because one of the infectious research in Jakarta is hospital. Because when you're going to hospital, you have to maintain the distance, and etc. So it should be part of your life, because when you got COVID-19 and you're a refugee, you live in very dense area or dense populations. So it's very dangerous. Maybe Bariska can add me.
Thank you so much. Rizka, is there anything you would like to add?
No, I think it's the capacity of Dr. Fajri to answer that question.
Thank you.
Yeah, okay. The next question is Bainhog healthy for Rizka. Are these regulations only apply for refugees or for everyone who lives in Indonesia?
So yeah, the regulation is applied to all of the people who are staying in Indonesia, whether it's refugee Indonesian or anyone foreigners who are forced to stay here longer because of the pandemic, they cannot going out. Yes, the regulation apply to all the people staying in this place. But you have to also respecting the local government regulation, which I already mentioned. In some part of the province or city, they have their own regulation. You might not see in my, for example, in my house in my house complex, no other than the resident in that complex can get in. So they have to stay outside of the gate, security gate, and then the people from the resident from that complex should go out to pick up the goods or meeting someone. And yeah, it's because my place is in West Java, so it's following the West Java governor regulation about the micro scale social restriction proportionally. So you might not find this type of restriction in any other place in any other part in Indonesia. So yes, the answer is yes. The short answer is yes.
Okay. The second question is the same from Bangkok Hilda to Dr. Fajri. What does the government of Indonesia doing to assist refugees during this pandemic?
Actually, I don't have any specific questions because I think I have to find the regulations more specifically. But what you can do, I'm checking. I'm checking before I'm talking. I'm checking if you want to swab test PCR, and you know you are suspicious regarding yourself, you can go to the primary healthcare in Jakarta. For example, if you are live in Kalideres, you can go to the primary healthcare of Kalideres. Then you talk and you show your identity, maybe you NSGR identity, maybe your passport or anything, and they should give you tests. I think because in case you're doing it is important to note that it depends on your domicile. It is depend on your place that you live right now. I'm in Salemba, so I'm in Johor Baru, Central Jakarta, Jakarta Pusat. So I have to come to the Johor Baru Primary Healthcare to check my COVID-19, to check the COVID-19 test, for example, like that. So, but I don't know if there's any maybe money or other supplement or other help. I don't know from governments, because I think it, and in the media there is no enough information to answer that questions. Yeah, it's enough for me. Maybe Bariska has good answer.
Yeah,
Priska?
thank you, then Dr. Fajri. Yeah, to adding Dr. Fajri, what is the government of Indonesia doing to assist refugee during this pandemic? Dr. Fajri already answered from the medical side that yes, you have the facilities from the government. You can be tested freely for COVID-19 test. Apart from that, from the social perspective, yes, actually Indonesian government already put refugee asylum seeker as the vulnerable criteria to receive help from the government. Yet we haven't found any practical step from the government to doing so, to be respective that this is the refugee community already put in the list of vulnerable community, but then what next? We haven't found any information on that. But yes, some of the refugee community that we asked said that they got social help. It's actually rice and some of the basic needs that you can use in your kitchen to provide daily needs for food. But it's not coming from the government. It's just from the community which the refugee lives, from the Indonesian community there. So there is no actually structural or systematic response from the government to the refugee community. So I think so. Thank you.
Yeah, this question is from Bashoki, and it applies both of the speakers. There are some hospitals that require COVID-19 examination. If you are accompanying a patient and the doctor decide for the patient to sit in the hospital, is this considered government decision?
Who's gonna answer first, Aden? Dr. Fajri? Oh, me, okay. So there is some hospitals that require COVID-19 examination before the treatment. Dr. Fajri, please correct me if I'm wrong. As far as I know, all the patients that wanted to get a treatment from the hospital, even though it's not COVID-19 related illness, should be tested for COVID-19. So it's kind of primary policy, if I'm not mistaken, from any healthcare facilities for the patient to get tested. So yeah, Dr. Fajri.
I'm sorry, I cannot get the question. Is it considered a government decision? What do you mean the government decision?
I've just read the question, but as according to the person asked the question says that there are some hospitals that require COVID-19 examination. If you are accompanying a patient and a doctor decide for the patient to sit in the hospital, is this considered a government decision?
What do you mean sit in hospital and government decision? What do you mean?
I don't know, because the question is
you have to know that every hospital right now is very suspicious to COVID-19 because the symptom of COVID-19 is very broad. You know, people come to the hospital with the complaint of the stomach ache. They feel pain in the abdomen or the stomach, or their tinnitus. Tinnitus is you feel like in your ear. You can COVID-19. You can get COVID-19 because of that. There's a lot of publication regarding that symptom or that diagnosis. I mean, if somebody got a heart attack or heart attack, it may be because of COVID-19. That's why a lot of hospital or almost hospital has they have a policy that make sure people when people come to the hospital, they should be screened of COVID-19. That's a policy. That's a policy because the manifestation of COVID-19 is very different and very broad. So can you imagine you are got diarrhea and you're COVID-19, and it's a fact. I have a lot of patients like that, and it's such as red eye. We call it conjunctivitis, infection of the eye. It could be COVID-19. It's that's why we should be aware and we should be know it. For example, another manifestation is like wheals, like urticaria. Urticaria is medical term. it means like it's like wheel. It's like redness of your skin. It's very itchy. Yeah, it's COVID-19. Can you imagine? Another example is it's like measles. You know measles? You got redness around your body, and it's COVID-19. It's like varicella cacar air kalau bahasa Indonesianya. It's varicella. Yeah, several people got COVID-19 like that. Yeah, so yeah, that's why they must be strict with the regulations, with this regulation especially, because it's very hard to differentiate between non-COVID and COVID patients, because the manifestation of COVID-19 is very broad. That's why they should check these patients, whether this patient has COVID-19 or not, by doing the test, such as PCR test or swab PCR test. I think it's enough. What next
Yeah.
question? I will answer all the questions. Please ask as much as you want. I will answer it.
Yeah, I think we are at the end of the event, and before we go to the closing remark, I would like uh, to have the speakers closing remark.
Oh, it's a lot of questions. You don't have to answer it.
Yeah, those are all questions.
I have a time. But
Okay,
it
sorry to
depends
jump
on-
in. So Dr. Fajri, do you still have time to answer
Yes,
more
I have
questions?
lots of time to you.
Okay, thank you so much. And Rizka, do you still have more time?
Yeah, sure.
Okay,
Sure.
so I will be posting another questions list. I think this one will be the last session for question and answer. So Aden, can you please check the pool of questions?
The chat box.
Nope. On the group, please. I
Oh,
just sent it. Thank you. We can
Okay.
continue with the last question and answer session. Thanks.
Oh, yeah. Okay.
Okay.
I've read it.
Roger, this question is to Dr. Fajri. Can someone contract COVID-19 more than once? Does
Yeah, of course.
to give money for the family of COVID-19 victim who passed away?
Okay. Yeah, I have the answer in my slide. Okay. Yes, people who get once COVID-19 can get once again. And this is the report. This is publications from This is publications from Yale University. It's from Professor Akiko. They publish in Lancet, one of the prestigious publication in the world. So there up to now it's maybe 26% or 30% got COVID-19 twice, or minimum twice. For example, one in Hong Kong, one in Nevada, Belgium, and Ecuador. The age is various. The first infections, all of them is mild. Then what we have to know is, after the first infection, the antibody doesn't appear, and after second infection, the antibody was appear. So it means we don't know pandemic will be end, because the antibody or the immunity after the infections, not everybody can make this antibody. And you have to know that the secondary infection, the two of them is more severe than the first infections, and the rest of the patients, the second infections, the manifestation of the second infection is milder than the first infections, and the the space of the period is various. 2 months, 3 months, and it's maybe 4 months or more. So yeah, does Indonesian government give money for the family of COVID-19 victim who passed away? I think there is, as far, I don't know, if correct me if I'm wrong, but as far as I know, there is no money, there is no compensations to people who pass away. But if you're a doctor or a healthcare provider, you can get compensate from the government. But if you're a common people or a community, there is no compensations. How about Mariska?
Rizka, any opinion?
Yes, there's no compensation. Yes, if you heard any information that this person is passed away because of the COVID-19 and they got a compensation, it's probably, I said probably, coming from the insurance company. So he or she might already registered in some insurance company and they get some money after the passing of the person.
Okay. This question is for Rizka from Omar. After the large-scale social restrictions end in 20 December, what will be done next?
Well, according to the regulation from the Jakarta governor, this is the 20th December is for Jakarta. On the regulation said that if the curve is not getting lower, it is increased and the number is also raising, so there might be another PSBB or large scale social restriction until 3 of January. In that letter said so. So if the curve is going lower and the pandemic is starting to vanish until 20th December, so there's no more PSBB, there is no more large scale social restriction, and we can go back to walking on the market without any mask. You don't have to washing your hands regularly, so it's will be like that from the regulation side.
This question is from Mutazim. It applies for both of speakers. And the question is, any advice for refugees to deal with current pandemic situation psychologically, e.g., dealing with stress and panicking, etc.? So,
Who's going first? And then?
Not mentioned. Both of the speakers.
Okay, maybe Dr. Fajri first.
Okay. Pandemic situation. The first of all, you just need to be aware, not to worry, not to very worry. You just need to aware. What it means aware? Aware is when you do something, you have to know where are you, then what do you want to do. If the activity that you want to do is not that important, you better to stay in your place or in your home. You don't have to going outside. And the second one is 80% of COVID-19 patients the positive COVID-19 patients is they have mild symptom or no symptom. The mortality is maybe around 2 until 5% of total patients with COVID-19. So the mortality rate. It means if you got infected, you have to be calm, because not everybody death because COVID-19, such as Ebola infection or MERS infections. It's the previous pandemics. This is a good question because I face and I meet a lot of people who cannot sleep, who are disturbed because of this thing, because of this feeling. So what you want to do is you just need to maintain your good healthy, such as you just need to maintain your sleep habit. You just need to sleep for 8 hours per day. You eat well, you drink well, then um, yeah, you don't have to eat anything if you are strong enough. I mean you just need to eat or maintain your regular health. Not you don't need to eat more vitamin C. No. You just need to eat well and balance. 5 times per day you eat vegetable. 5 times per day you eat fruit. So that's enough, and you maintain good distance, uh, or you are going to, when you are going to outside, you bring your own tools or anything. That's it. That's enough. So you don't have to be too worried regarding this disease. You need to be aware, but not to worry. If you want some more information, you can see my Instagram. Thank you. Yeah, Mariska. Silakan.
Okay. From my side, actually, because I'm not capable to talk about psychological things, and I'm not an expert, I don't have any science in that as a psychologist, or having a psychological science. I don't have it, but I'm just wanted to share that
endpoint of
I just wanted to share my own experience that yes, we have anxiety when this work from home coming, and then we have to stay at home for a week or more. For those who are introvert enough, this is maybe a golden time to be alone. But for those who are extrovert, maybe this is the hard time for them. So I think based on what I learned from other people, that we have to aware of ourselves first. Are we how are we feeling comfort enough, and how we getting that comfort by staying at home, or uh, having that awareness if we are going out, what we should have and what we should do, but not taking too much, like Dr. Fajri said. So yes, I mean, the starting point is aware of yourself first. I guess so. Thank you.
Yeah, we are at the closing sessions. So, is there anyone who would like to add something? Because we still need to have your closing remark, both speakers, Fajri and Sister Rizka.
Yeah.
Okay, Dr. Fajri first, yeah.
Oh, okay. Up to now, there is no curable treatment of COVID-19, and the vaccines, the proof vaccines, is far from Indonesia. If you are in UK or in United States, it is maybe it's an opportunity to you to get that vaccine. But right now, you don't have any choice to access that vaccine. So the thing that you have to do right now is maintaining the health protocol. You have to maintain the distance. You have to you have to minimize your activities at outside or at another place if it's not that important to you to go to there. And you have to eat well. You have to have a balanced life, and you just not you are not allowed to think too much, because you just need to take care of yourself and your family. I think it's enough, and you don't have to buy anything. You just need to live like usual, but but you just need to improve yourself. It's my final statement.
Okay, from my side, yeah, from the regulation side, that the regulation is was issued, enacted for all of the people in Indonesia. So that's mean I already say that for a couple of times, and for closing remarks, I said it again that the regulation it's also for refugee communities, also for foreigners, also for Indonesian, elderly, youth, child, anyone. The regulation apply to all of us. And yes, there are still lack of regulation, yes, for refugee community, because I already mentioned that refugee is already included in the vulnerability list in the government, but yet there's no response to that. So what SWACA will do next actually is to push the government also doing some response to this during this pandemic to the refugee community, because yes, the impact of COVID-19 is not only for Indonesian losing jobs, it's also for refugee community also. We are all having the same impact, but yet we are not standing in the same position. So yes, I hope that by having this discussion, we are already aware of what is COVID-19 and what is regulation impacting as a response to the COVID-19, and we are aware of what we going to do next. Thank you.
Thank you so much, both of speakers and everyone else, and all. Thank you for your active participation.
I want to, sorry for interruption. I want to respond the Elza based on research experience, because I think it's important. I'm trying to avoid the misinformation. Based on our experience with Puskesmas Pisangan, they will conduct swab PCR or rapid test to those who have symptom or as tracing efforts or has active result of rapid test include for refugee and for free. But Puskesmas does not able conduct the test based on individual request. That's true. My previous informations, from that information, if you are suspected or if you are meet somebody who has positive COVID-19, it means it is part of tracing. But if you don't have any symptom, if you don't meet anybody who has COVID-19, you just stay in your home and you want to know whether you whether you have COVID-19 or not in your body. No, they will not conduct a test to you. You should get a symptom, or you have to be part of the tracing efforts, or you are got positive result of rapid test antibody. And the last thing that you can do is you can download the Jaki is applications mobile. I think you can download it, but I don't know you can use or not, because there is a social number to open the applications. And that application you can you can do the self-assessment, and then you can understand that are you fulfill the requirement to do the swab test at Puskesmas or not. The cutoff point of the score is, I think it's 70% or not, something. Yeah, thank you.
Okay. Before we close the event, there is one thing I would like to remind each one of you. Please turn your camera on. We are going to have a group photo. This will be worker documentation only. And then the second thing is we are going to fill the feedback form which is in the chat box. So thank you so much. Welcome to the camera. Turn your camera on. We are going to have the group photo. Thank you.
If you are not comfortable with the turning on the camera, please also set it off like you used to. It's okay. It's live on YouTube.
Okay, smile. 1, 2.
Once more, please hold. 1, 2. Okay, thank you, everyone.
Thank you. Thank you. Stay healthy.
Thank you.
Don't get too much anxiety ya.
Iya, santai aja.
Success for all. Keep healthy.